What is ctDNA for cancer blood tests? Imagine a tiny piece of the puzzle that can tell us a lot about cancer without needing to cut into the body. That puzzle piece is called circulating tumor DNA, or ctDNA. It consists of small fragments of genetic material released into the blood by cancer cells as they die or sometimes actively shed DNA into the bloodstream. These fragments carry specific genetic information unique to the tumor, including mutations and alterations that set them apart from normal DNA. Because they come directly from cancer cells, ctDNA is a valuable marker for understanding what is happening inside a tumor. In the world of cancer diagnosis and management, ctDNA testing is often called a liquid biopsy. Instead of needing an invasive tissue biopsy, doctors can analyze a simple blood sample to gather important molecular details about the tumor. This approach is minimally invasive, quick, and can be repeated easily over time. It helps in several ways. First, it can detect the presence of cancer by identifying tumor-specific genetic changes in the blood, which can sometimes reduce the need for more invasive procedures. Second, it guides treatment decisions by revealing genetic mutations or alterations in the tumor that may influence which therapies are most likely to work. For example, if certain mutations are found, targeted therapies might be more effective. Monitoring treatment response is another key use of ctDNA testing. When a patient undergoes treatment, measuring ctDNA levels can show whether the tumor is shrinking or growing. A decrease in ctDNA usually indicates that the treatment is working. It can also help detect minimal residual disease, which means tiny amounts of cancer cells that remains after treatment and could cause a recurrence later on. Detecting these small amounts early can allow for timely intervention. During remission, ctDNA testing can be used to watch for signs of cancer coming back. If ctDNA levels rise again, it might signal a recurrence before any symptoms or imaging tests show it. This early warning can be crucial for prompt treatment. In colon health and colon cancer specifically, ctDNA testing is increasingly used after surgery and chemotherapy. It helps identify patients at higher risk of recurrence who might benefit from additional treatment. It also offers a way to catch recurrences early, potentially improving outcomes. The amount of ctDNA in the blood depends on factors like tumor size, location, and stage. The fragments are very short, usually between 70 and 200 base pairs, and they have a short half-life in the blood, often just minutes to a few hours. This means ctDNA levels can reflect real-time changes in the tumor. While ctDNA testing shows great promise, it is still an emerging technology. It is used alongside other diagnostic tools like imaging and tissue biopsies, not as a replacement. Sometimes, ctDNA tests can give false positives or negatives, especially if the tumor sheds very little DNA into the blood or if there is non-tumor DNA present. Overall, ctDNA testing is a valuable addition to the tools used in diagnosing, planning treatment, and monitoring colon cancer. It aligns with current medical guidelines aimed at personalized care, helping to tailor treatments to each individual's situation. If you or someone you know is considering ctDNA testing, it's important to discuss with a healthcare professional to understand whether it's appropriate and how it can fit into a comprehensive care plan.